Have you ever been on the wrong side of the tracks driving around through downtown Orlando? If you ever see Division Avenue, know this, that once upon a time, if your skin was the wrong color, that was as far east as you could live in Orlando. Even today, in so many cities in America, the vast majority of folks' potential is determined by the zip code in which they live. The fact is that 50% of the children that are in poverty are growing up in neighborhoods of concentrated poverty. And if you live in one of these neighborhoods, you're 7 times more likely to be in poor health than your middle-income peers and 3 times more likely to drop out of high school. So when a group of business leaders gathered to consider how they could pull together their social responsibility resources within one community and try to move the needle for change and good and improve the lives of those who did not have a voice for themselves in Orlando, we landed on the fact that we had to base what we did on a smaller footprint.
You know, the total renovation of a stadium that has sat in the middle of some culturally rich neighborhoods for over 7 decades now was the impetus for us to say, how could we view this relationship with the community differently? If it could become a beating heart in the center of that community was the impetus for LIFT being created.
Considering how then that allowed us to be holistic in our approach, to seek the whole person's well-being and addressing housing and education and health and wellness and economic development that would help lift up neighborhoods from a position of being isolated from opportunity and progress to being connected in relationship with the broader community around them and in contact with the avenues for great possibilities that all of us hope for. But none of what we're talking about would be possible without the partnership of Florida Hospital, who's been leading the way for us in the realm of health and wellness and approaching the holistic needs of the entire neighborhood with a vision for the long-term commitment of seeing people not only rise out of poverty, but out of illness and disease to lives that are whole, healthy, and complete.